Welcome. Today, we're tackling a hidden danger inside our bodies: blood clots. Think of your veins and arteries as highways for your blood. A clot is like a sudden roadblock disrupting the flow. Blood clots can form silently, often without warning, but their impact can be life-changing. Our goal is to make this topic clear and give you practical knowledge to protect yourself. Blood clotting is essential. It stops bleeding when you're injured. But when clots form where they shouldn't, they can be dangerous. We'll explore what blood clots are, who's at risk, warning signs, and how to prevent them. This isn't about memorizing medical terms. It's about understanding your body and being proactive. By the end, you'll know how to spot trouble early and talk confidently with your doctor. Let's get started and empower you to take charge of your health. Remember, awareness is your best defense. Your health is your greatest asset. Let's protect it together. So, what is a blood clot? It's a gel-like mass that forms to stop bleeding when you're injured. A vital life-saving process, but sometimes clots form inside blood vessels without injury. These are the dangerous ones. Helpful clots heal wounds. Harmful clots block blood flow, depriving organs of oxygen. The real danger comes when a clot breaks loose and travels. This is called an embolus. If it lodges in the lungs, it causes a pulmonary embolism. In the brain, it causes a stroke. In the heart, a heart attack. These events are medical emergencies. Our bodies need a delicate balance at enough clotting to heal, but not so much that it causes harm. Genetics, lifestyle, and health conditions can tip this balance. Understanding this dual nature is key to managing your risk. Don't fear clotting. Respect its power, and know when to seek help. Recognizing the difference between friend and foe can save your life. Stay alert to your body signals. Knowledge is your first step toward prevention. Let's focus on deep vein thrombosis, or DVT, a common and dangerous type of blood clot. DVT forms in deep veins, usually in the legs or pelvis, and often develops with few or subtle symptoms. Signs include swelling pain, warmth, and discoloration in one limb, often mistaken for a muscle strain. The real threat is if the clot breaks free and travels to the lungs, causing a pulmonary embolism. A pulmonary embolism blocks blood flow in the lungs, which can be fatal if not treated immediately. DVT isn't just a leg problem, it's a potential trigger for a life-threatening emergency. Recognizing DVT early and seeking prompt treatment can prevent disaster. Don't ignore unexplained swelling or pain in your leg. Quick action saves lives. Stay informed and vigilant. DVT and pulmonary embolism affect up to 900,000 Americans each year. Tragically, up to 100,000 die annually, more than from AIDS, breast cancer, or car accidents. Many deaths happen suddenly, with no warning until it's too late. Survivors can face long-term complications like chronic pain and swelling. Once you've had a clot, your risk of another is higher. The good news? Many of these tragedies are preventable. Early recognition and treatment make a huge difference. Awareness and action can change these statistics. Your knowledge could save a life, maybe your own. Who's at risk for blood clots? Anyone, but some factors raise your chances. Prolonged immobility is a major risk. Long flights, car rides, or bed rest slow blood flow. Risk increases with age, especially after 60. Surgery, injury, or hospitalization can trigger clot formation. A personal or family history of clots means higher risk. Chronic illnesses, heart disease, cancer, inflammatory conditions also play a role. Being overweight, smoking, and pregnancy add to the danger. Some medications, like hormone therapy or birth control, can increase clotting risk. Talk to your doctor about your personal risk factors. Knowing your risks is the first step to prevention. Stay proactive about your health. Your body often warns you when something's wrong. Learn to listen. DVT symptoms: sudden swelling pain, warmth or color change in one leg or arm. Sometimes only one symptom appears or none at all. If a clot travels to your lungs, symptoms change: sudden shortness of breath, sharp chest pain, rapid heartbeat, or fainting. These are red flags. Call emergency services immediately. Other clots can cause severe abdominal pain, blood in urine, or stroke symptoms like confusion or weakness. Don't ignore these signs or wait for them to pass. Quick recognition and action are critical. If you suspect a clot, seek medical help right away. Trust your instincts. Better safe than sorry. Early intervention saves lives. Stay alert to your body's signals. Prevention is your best weapon against blood clots. Stay active, move regularly, especially during long periods of sitting or travel. Maintain a healthy weight and exercise often. Quit smoking. It damages blood vessels and increases clot risk. Wear loose clothing and elevate your legs when resting. Before surgery, discuss clot prevention with your doctor. Follow medical advice after procedures. Use prescribed medications or compression devices as directed. If you're on hormone therapy or birth control, talk to your doctor about risks. Take blood thinners exactly as prescribed if you have a clotting disorder. Small daily choices add up to powerful protection. We've covered the dangers of blood clots, the warning signs, and how to protect yourself. This knowledge is your shield. Use it to stay safe and help others. You have more control than you think. Stay active, manage your health, and be alert to symptoms. Don't dismiss swelling or pain. Act quickly. If you notice sudden shortness of breath or chest pain, seek emergency help. Share what you've learned with friends and family. The more people who know the signs, the more lives we can save. Listen to your body and trust your instincts. You are your own best advocate. Stay informed, stay proactive, and protect your health.